Hey gang, we're going to talk about chiropractic technique mastery today, and this is especially for folks who love chiropractic, you know what I mean? Who love getting sick people well, who love doing a great job and doing right by their patients. And so I want to just talk about this because one of the best pieces of advice that I ever got when it comes to being a student, when it comes to getting ready to open up your own practice, one of the best pieces of advice I ever got was to go visit as many clinics as possible, right? And why? Why is that important? And I want to come back to technique in a minute, but why is it important to visit as many clinics as possible? The truth is, the reason is because when you're in school, you don't really know how you might want to practice until you see different styles of practice, you know? And that's easy to understand when it comes to practice management. You know, what colors the walls are going to be, the carpet, how you're going to lay it out, the flow of the office. Like, we understand the value of seeing many practices when it comes to that aspect of chiropractic. But when it comes to technique mastery, what we think in our brain is that I'm going to master this one technique. And by the way, you do need to become proficient by the time you graduate. It's one of your highest responsibilities is to learn how to adjust people while you're in school. You can't wait till after you graduate. You need to master that. But where we get a little bit of a mistake is we think as we hone in on one technique or another, that in doing that, we become a master of that technique. And let me just give you an analogy here. It reminds me of mixed martial arts, okay? So chiropractic techniques are a lot like the different martial arts that are out there. And when the UFC came around, you'd have the wrestler who would compete against the boxer, and then the boxer would compete against the jiu-jitsu guy, and they would come into the ring with their own techniques, right? And then as the UFC evolved, you'd find these true mixed martial artists like George St. Pierre, who was a wrestler, but he was also a striker, you know? And he was the first one that was probably really multifaceted and well-versed. And he dominated for a very long time. Then you fast forward another generation, and you get to true masters of the art of fighting, like Conor McGregor. And one of the things that Conor McGregor said, he was fighting Jose Aldo, and at the time he was training with a capoeira movement expert named Edu Portal. And Edu Portal was all about understanding the body and how it moves. And one of the things that Conor said, and I thought it was brilliant, is he said, you know, when people throw a punch, what most technique gurus see is a punch. And they have their mechanical defense to a punch, right? It's a linear movement. I know when someone throws a punch, I'm supposed to do X, Y, and Z. But what Conor said was that it's not just a punch. It's an arm, and it's a hand, and it's an elbow, and a wrist, and it's all these things that make up this punch. So if you just see it as a punch, then you're limited in what you can do with it. And it was either Conor or Edu Portal who said this. When you see a punch, if all you see is a punch, then you're limited in how you respond to it. But if you see it for what it is, which is a moving arm that has joints and, you know, fingers and knuckles and wrists and elbows and shoulders and all these things, and it moves, and you understand the biomechanics of the arm and how it moves, now your options expand. Your consciousness and your awareness of what to do with this arm that's hurling towards you is expanded. And then you can truly be a master because you can manipulate the arm. You can dodge the arm. You can work with the momentum of the arm. You can do a million things. And here's why I say that. When you look at the techniques in chiropractic, there are levels, right? So the first level is we're going to learn these different techniques. Just like the wrestler, just like the jiu-jitsu player, or fighter, just like the boxer. And the next level of the technique mastery is I'm gonna learn boxing really well. I'm gonna learn Blair really well. I'm gonna learn knee chest. I'm gonna learn Gonstead. I'm gonna do it exactly the way that Bill Blair did it. I'm gonna do it exactly the way that BJ Palmer did knee chest. I'm gonna do it exactly the way that Clarence Gonstead did cervical chair. And a lot of people stop there. And what I'm suggesting to you is that there's another level. And at that highest level, I feel, is true mastery, where you get on the shoulders of the mentors above you and you look around and you understand what they understood. And then you start learning from others. And so, for example, if you look at another parallel to this would be, if you want to be an oil-based painter, right? You think, I'm going to learn oil-based painting. And so you learn from one person oil-based painting. And you learn all the techniques that person knows in how to paint with oil. But you're going to be limited to that one person. You know what I mean? If you went and learned from 10 different oil-based painters, what you might learn are the nuances and techniques in how to manipulate the paint and the chemistry and the canvas and the timing and the shades and all the different things. And my punchline here is that, no pun intended with a punch, but my punchline here is that, yes, you want to master a given technique system, but you want to master it from different masters. If you're going to learn Blair and learn it well, you should take Blair from as many instructors as you possibly can. If you're going to learn Gonstead and you want to really master Gonstead, you should learn Gonstead from as many Gonstead instructors as you possibly can. Because what you'll find are the nuances of the technique from all the different angles. Any technique that's worth its salt is not just, about these lines on an x-ray and you have to place your feet here. And it's not, as much as we want to make it robotic and repetitious and reliable and consistent, as much as we want to make it that, the reality is every patient is extremely different in their genetics, in their trauma history, in their listings, in their day-to-day lifestyle, in their presentation. And so if you are going to be a master at this thing, then you really need to learn from as many different masters as you can until you fully see it. The way Palmer even talked about this, seeing it in your mind's eye, the way the bone is moved and corked and twisted and turned. It's not just an ASR, it's not just a category 2, it's not just a PLI, it's not that at all. It's a human being with unique articulations, with unique anatomy, unique scenarios, unique situations. And to be a true master of this thing, you need to take into consideration all of these things so that when you lay your hands on the patient, you know that it's perfect for them. And that's a unique thing. And with each patient, it's a unique thing. So do the levels, right? Do your cursory initial level and learn different chiropractic techniques. Hone in on the one that you want to really master, the one or two that you really want to do well at. But then take that next step and learn from as many different people that have achieved mastery in that technique as you possibly can. Because that's when you'll get the different shades. That's when you'll understand all the different levels. And you'll stop looking at an ASR like just an ASR. And you'll realize that it's more than just that. It's a cork and a twist. There's some orthogonal considerations. There's some segmental considerations. There's some tonal considerations. There's biomechanical considerations. There's all these different considerations. And then you'll have the experience from different masters to say, oh yeah, when this biomechanical consideration is present, I can pull this paintbrush out of my toolbox. I'm still using oil paint. I'm still using the Blair principles of biomechanics, but I'm going to modify my stance just a little bit. Or maybe I'm going to do this alternate contact adjustment because of this reason. And if I do it ahead of time, then I don't have to waste precious time with this patient, and I can get better results faster and sooner. So with that said, if you need help in that journey, if you are a chiropractic student or you've been in chiropractic for 5, 10, 15, 20 years, one of my core principles is that school's never out for the pro, right? One of my core values is education, right? School's never out for the pro, and we are all professionals. And if you want to learn and you want to grow and you want to develop, especially in the upper cervical work, my loud mouth and personality has gotten me in a lot of circles. And if you're looking to learn and grow and develop mastery in upper cervical and you want some advice on who to learn from, let me know. It doesn't matter if it's Blair, knee chest, orthogonal work, tonal work. I've met a lot of wonderful people, and I'd be thrilled to help you in your journey. If you have never learned from me when it comes to the Blair work, it's time to get on it. I'm going to be at Sherman in April 2025, and you don't want to miss that. I love teaching the Blair work and helping people understand deep down on a three-dimensional level how these bones move, so we can get out of our own head of like the listings and the angles and the placements. You have to have that, but you need to know why. You need to know why that's important. Otherwise, the what won't ever measure up. So if you need some help in this area, let me know. With that, I successfully did this without crashing, and hopefully you're having a wonderful week, and we'll see you guys around.